Hi, this is George with 573 Medicine, and in this video we're going to be going over intercellular junctions. So let's get started. The first junction we're going to be talking about are tight junctions, which are also known as zona occludens. So here we can see adjacent epithelial cells, and between those cells we have what are called tight junctions. So tight junctions function as serving as a barrier and regulating paracellular transport through the paracellular space. So let's pay attention to the name. Zona occludens. These are responsible for occluding or preventing the transport of water and other electrolytes through the junctions. So, for instance, kind of like a Ziploc bag, these are these protein complexes, and they prevent the diffusion of water between this intercellular space. And this is important because you don't want water to be getting into this intercellular space, or salt, because salt follows water, because you want to maintain that sort of integrity between the epithelial cells. And so these intercellular junctions are made up of claudin and occludin, amongst other proteins, that interact with the cytoskeleton of the connecting epithelial cells. The next junction we're going to be talking about are the adherens junctions. So the zona adherens are the belt desmosomes. So in this one, we have the word adhere into the name. So adherens junctions, we can see in adherens junctions between adjacent cells. These are going to aid in the mechanical strength of these intercellular connections. So these are going to be like glue. These are going to help the adherence of adjacent cells. And so these are composed of cadherin proteins. So cadherin stands for calcium-dependent adhesions. And this facilitates the intercellular connection via the actin component, so the microfilaments of the cytoskeleton. And adherens junctions, specifically cadherin, is incredibly important clinically because some cancers can actually metastasize if there is less expression of cadherins. The next structure we're going to be talking about are the desmosomes. So desmosomes are also referred to as spot desmosomes or macula adherens. So they are responsible in the adhesion of adjacent cells. And these are important in the structural support of these intercellular connections. And desmosomes connect cells via intermediate filaments of cytoskeletons. So remember, this intermediate filaments are part of the cytoskeleton, and the desmosome is going to attach to the intermediate filaments of both of the cells and facilitate this intercellular connection. Part of the desmosome is called desmogliin, and this is incredibly important because autoimmune destruction of desmogliin is going to lead to an autoimmune disease called pemphigus vulgaris, which is going to present with blistering of the skin. So this is a patient with pemphigus vulgaris, and I think if we can appreciate this normal skin in the bottom right here, we can see that there's a problem in the connection between cells. So cells aren't connecting between one another. And this is because of a problem in the desmosome, specifically autoimmune destruction of desmogliin 3. And something else that I think is important to point out, and I'll explain why later, is that this deep layer of epithelial cells is still adhering to the basement membrane. And I'll show you why I pointed that out in this next slide. So this is another picture of a desmosome, which is going to facilitate those intercellular connections. Remember, macula adherens. And we're actually going to be talking about hemidesmosomes. So hemidesmosomes kind of look like half of a desmosome, and that's why they're called hemidesmosomes. And these are going to connect keratin and basal cells to the basement membrane. There's a disease called bullous pemphigoid, and this is actually going to be due to autoimmune destruction of the hemidesmosomes, and this is going to manifest in patients as blistering of the skin. So this is a patient with bullous pemphigoid, and here we can see that the basement membrane that separates the connective tissue matrix from the epithelial cells is actually destroyed. So there are no adhesions really between the basement membrane in certain areas and the superficial epithelial cells. The next intercellular connection is going to be our gap junctions, and this is going to facilitate communications via the transfer of ions. And these transfer of ions are important physiologically in many reasons. But one of the most important is going to be allowing individual muscle cells, to function as a syncytium. So adjacent muscle cells can communicate with one another and transport those excitatory neurons in order to recruit lots of cells to contract at the same time and get more force going on. So this is a picture of the heart, and if we zoom in, we can see these individual cardiac muscle fibers, and we have what are called intercalated discs. And these intercalated discs are actually a way to determine that you are looking at cardiac muscle on H&E. And they're also a special type of gap junction that allow for the transport of ions to allow a robust recruitment of adjacent cardiac myocytes whenever there's contraction. So it's a great way for these cardiac cells to communicate with one another. And so that's it for this video. If you liked the video, feel free to like, comment, and subscribe, and feel free to email us anytime at realtalkmeded@gmail.com.